So we're just going to spend a few minutes talking about some of these terms, and you can read through this and make flashcards yourself. And so there's no sense in me, spending a lot of time explaining each of these because it's really just memorizing what the words mean. It's a little bit like learning a new language, really. But these are terms, especially if you end up working in a healthcare setting, that will be thrown around a lot and you'll get really comfortable with because you'll be using them all the time. I'd like to think that you enter nursing school or whatever professional program you're planning to enter knowing what these words mean and having some familiarity with them. So let's talk about first signs, symptoms, and syndrome. A sign is an objective evidence of a disease. For example, something that the doctor can measure like a fever. So they can actually take your temperature and say, oh, you actually are sick because you have a fever. They might be able to see a red throat or see a rash on your skin, for example. Those would be signs of disease. Symptoms are, in some ways, the way a patient reports how they feel, right? You say, I have a headache, I feel nauseous. If you vomit in front of the doctor, that would be more of a sign, but just feeling a little queasy, feeling tired, those are symptoms. They're hard for a doctor to measure. And then we associate a group of signs and symptoms together as a syndrome. So this is where, a group of signs along with symptoms reported by a patient signal that there's a specific disease that patient is suffering with. Now, all of this can be caused by the pathogen itself or the immune system. One of the things we've been talking a lot about with COVID-19 is the idea that the immune system is actually creating the situation where people get really sick because it's your immune response to the virus that causes so much damage to the lungs. So signs, symptoms, and syndromes are sometimes caused by the organism itself doing damage to you, but they're often also caused by your immune response as well. This is a nomenclature of symptoms. And again, I strongly encourage you to go ahead and get some flashcards and just commit these to memory before the next test. Cyto means cell, so cytopenia is a reduction in the number of red blood cells, but if you see cyto, it means something about a cell, right? Hepat is related to the liver. Hepatitis, for example, is caused by it's caused by 5 different viruses. We're gonna focus on 3 of them when we talk about it later on. Pathy means disease, so neuropathy would be a disease of your nerves. Emia means blood or of the blood, so bacteremia means there's bacteria in your blood. Inflammation, we refer to itis, so colitis would be inflammation of the colon. Arthritis means inflammation of joints, right? Something that's undergoing lysis is being destroyed. We've talked about lytic cycles of viruses. So hemolysis is an example where maybe a bacteria destroy red blood cells. There are some bacteria that make toxins that can do that. Oma means tumor. Lymphoma would be a cancer of your lymphatic system. Osis is a diseased or abnormal condition. So leukocytosis would be an abnormal number of white blood cells. Derma means of the skin. So keratoderma is a thickening of the skin. So these are prefixes and suffixes that you will often see appended to other names, like hepatitis has both the liver and the inflammation. So the person has an inflamed liver. So just to tuck these away, they'll be useful for you in your medical career. What about infectious types or infection types? If it's an infectious disease, that means it's caused by a pathogen. And I should point out that there are many diseases that are not caused by pathogens. So for example, if you have a heart attack, that's usually caused by your age and potentially diet and lifestyle, etc. So plenty of diseases are not caused by pathogens, but certainly lots of them are. And when they're communicable, that means they can be spread from person to person. And you're probably thinking, well, what kind of infection isn't communicable? Well, actually, there's quite a few. I'll give you one example, and that would be something like tetanus. That's caused by bacteria that you don't get tetanus from another person. You get it from tetanus spores, or it's the Clostridium tetani, the bacteria. The spores of that organism get into your skin, deep into your skin. It's an anaerobe, and then it causes an infection. So if I have tetanus, I can't give it to you, but it's certainly an infectious disease because it's caused by a pathogen. Something that's contagious, so if it's communicable, it's spread from person to person. If it's contagious, it's easily spread from person to person. So for example, COVID-19 has turned out to be really contagious, and that's one of the reasons it's caused such big problems for us. Iatrogenic means that you got an infection as a result of a medical procedure, which is a slightly different thing than nosocomial, which means you acquired that infection in a hospital setting. And then zoonotic are infections that are transmitted animal to human. So many infections begin as a zoonotic jump. They make that leap from animals to humans, but then they will transmit human to human after that. Right, so zoonotic often will refer to the first transmission. We get all of our emerging diseases from other organisms that are non-human. When you get sick, we talk about the steps involved in that disease. So there's an incubation period. You've heard a lot of these terms lately. I almost don't have to teach it, because when we're living in the age of pandemic, this is on the news every night. They're doing my job for me. But there's certainly an incubation period. And this is the period where you have been exposed, the pathogen is in you, and it may be beginning to multiply, or it should be beginning to multiply if you're going to get sick, but you don't really have any sense that you're sick yet. And so you would be potentially infectious but asymptomatic. A lot of times people are not infectious during the incubation period. Now, the prodromal period is the period where, you wake up and you think, I feel a little bit not well, but I'm not sure. I think there are times when I'm pretty sure I've been exposed to a virus and I feel a little under the weather, but then maybe a couple days later, I really don't feel bad anymore. And I think, oh, my immune system really fought this off. But that prodromal period is that feeling of sort of beginning initially to be unwell. And then there becomes a time when you actually are confident you're sick. So this would be a period of illness. Your different textbooks have a different list here, but so period of decline is another phrase that just is basically saying, you have this period of illness where you're getting worse, and then it kind of peaks, and then you begin to start feeling better. And then when you're feeling much better, we talk about that as being a convalescent period. And so they show some, the more severe the symptoms are, the higher up it is on this graph. And then the number of pathogen particles typically corresponds with how severe your symptoms are. So your body's fighting off the illness, it's starting to fight off the number of pathogens that are present, and then as they are gone, then you're going to really convalesce from this illness and start to get back to your old self again. All right, more terms for you. Acute disease would mean that it's a very short time frame. So for example, COVID-19 is an acute disease. It causes brief illness, even though being sick for 10 days or 2 weeks doesn't seem brief. That's actually very short. Compare that to someone who has a disease like diabetes, for example, or Parkinson's disease. Some of the diseases of aging become very chronic, where you're sick for months to years or for the rest of your life. But acute disease, you get very sick and then you get better. So these are things like influenza, common cold, etc. They're acute. Chronic diseases, we tend to think of more in months and years. So infectious chronic disease might be something like H. pylori that causes infection in the stomach. And then there's also things like tuberculosis, which will cause people to be sick for months and years. And then there's also latent disease. So this is where a pathogen goes dormant for extended periods. And my favorites of these are the herpes viruses, but there's, so herpes simplex virus, and this is VZV is varicella zoster virus, and EBV is Epstein-Barr virus, which is one that we haven't talked about, but is another one that can go latent. It can cause an infection, and then it can actually go latent, and we associate it with some kinds of cancer. What about pathogenicity and virulence? A pathogenicity just refers to the ability to cause disease, but virulence is the degree to which an organism is pathogenic. So for example, it can be pathogenic but not particularly virulent, or it can be pathogenic and extremely virulent. So that refers to just how much disease is caused, okay? Now, we also talk about infectious doses and lethal doses. And so the median infectious dose, or the ID50, infectious dose 50, that means what percent are, how many organisms do you need for 50% of people who are exposed to get sick, is what that means, okay? How many pathogens gets 50% of exposed individuals sick? So that tells you, like for example, in foodborne illness, maybe the ID50 is very low, that just a few organisms will make a lot of people sick, or maybe it's really high and that it's less likely to cause a problem. The median lethal dose is called the LD50, and this is asking how many pathogenic agents kill half of the organisms exposed. We use LD50 in a lot of different ways. So we will often do studies on toxicity, studies of toxicity for drugs, and we'll look at LD50s in rats or mice. And so they'll give the mice look at dose response and see, what dose is required to kill half of the rats or half of the mice. And this is one of the things we do with drugs before we put them into clinical trials in humans, is we try to establish that we're not giving them what is potentially a really lethal dose. But we also use it for bacteria and viruses and other pathogens as well. These are ID50, so infectious doses for selected foodborne pathogens. And so sometimes in class I'll say, wow, it only takes 18 viral particles to cause a norovirus infection. And that's where this information comes from, this idea that it has a very low infectious dose. And so they say 1 to 10 here. I think I've seen 18 other places for norovirus, but it's spectacularly infectious. It's one of my favorite ones to talk about. So I'm looking forward to that disease of the day. Hepatitis, 10 to 100. These are all, hepatitis A is a foodborne pathogen. Rotavirus is another one. Those are viruses. Bacteria, remember E. coli 0157H7, which is particularly dangerous, has a fairly low ID50, but some of the other ones, it's actually, you need many, many, many organisms before you get sick. Protozoa, you only need one organism of Giardia, one Giardia organism individually can cause Giardia. Okay, so you get the idea here that different pathogens have very different requirements in terms of an infectious dose. If you get infected with this E. coli and you only get 10 organisms, you're not going to get sick, or highly, highly unlikely to get sick, especially if you're healthy. What about primary pathogens and opportunistic pathogens? This is something we've been talking about when we talk about our disease of the day. So hopefully you're already feeling comfortable with this. But a primary pathogen is an organism that can cause disease in a healthy host. Okay? An opportunistic pathogen only causes disease in situations that compromise the host defenses. So for example, if someone doesn't have a strong immune system because they're infected with HIV, they're going to be more vulnerable to having varicella zoster virus reactivate as shingles, or getting their tuberculosis to go from latent to active disease, right? So those would be acting as opportunistic pathogens because the person had a compromised immune system. Staph aureus I think of as an opportunistic pathogen because usually it causes infections in the skin and it has to get into the skin to do that. And so usually it takes advantage of a break in the skin. We also know that people in general who are very young, who are very old, women who are pregnant, and those with other diseases that result in compromised immune systems, or for example, someone who's a burn patient who's had their skin burned off in parts, they're going to be more vulnerable to opportunistic infections because they aren't able to fight things off, or in the case of a burn patient, the skin, which is an important barrier to pathogens, is gone, and so you have to keep that area very sterile and protected until the skin is able to heal. All right, I already said that virulence has to do with the degree of pathogenicity, and the kinds of things that affect virulence have to do with how easily it gets into the host. It has to do with how well it's able to attach to the host, because it has to get in and then it has to stick. It has to attach effectively in order to begin to cause disease. Then once it gets in you, how much damage does it cause? Some bacteria make enzymes that do tissue damage. Some bacteria make toxins that cause all sorts of different illnesses. And so these kinds of features of a pathogen we refer to as virulence factors. All right, so we will be talking next about virulence factors and just the process of the disease progression in a organism that's gotten sick. What are the steps of infection from getting into the host to vacating the host and then causing illness, hopefully for the pathogen in a new host. All right, so that's our next topic, the process of infection.